And for more on what President Trump meant and can do, we go live to journalist James Reinl in New York. James, what would an enforceable quarantine for New York, parts of New Jersey and Connecticut actually look like?
Enforceable, that's the question, because obviously President Trump does have some powers at the national level, but power is spread out across the United States, and there's a lot of power resting with the governor of the state, Andrew Cuomo, and also with the New York City authorities and other local authorities across these areas that are, let's face it, hotspots in the United States. New York, 52,000 cases confirmed already. Other numbers also in Connecticut and New Jersey and other hotspots across the United States. What Trump might be considering imposing is some kind of travel ban, so that if people want to move between one state and another. He did make reference to the fact that large numbers of New Yorkers have homes elsewhere. He mentioned Florida. Also, lots of people have left town already, gone to their homes out on Long Island, for example, or up in Connecticut. And what do? A large number of cases, confirmed cases in New York. If people are leaving and going to different parts of the country, what's going with them? COVID-19, of course, and the worry is that these cases get brought and they're spreading and starting new outbreaks elsewhere in the country.
And this appears to be a bit of a U-turn for President Trump, who, as our viewers know, said what he calls the Chinese virus at one point was a hoax. How is this announcement of a possible quarantine likely to be perceived by the public?
Well, I mean, the first thing that you think when you hear that the area in which you live is going to be subject to a quarantine, the first thing that goes through your minds is, maybe I need to get out now. So some people are predicting that even though Trump has mentioned this and not actually come through on any order at this stage, means that people are going to start leaving the city in greater numbers than they already have. You know, the reasons for doing this are quite obvious. People here are scared. The city has turned into something of a ghost town. Large numbers of people are leaving already. The streets are relatively empty. Every 20 minutes or so in this street alone, I hear an ambulance going past. We've had 500 deaths in the city so far. We're hearing that there aren't enough ventilators, that there isn't enough protective equipment for the doctors, that the hospitals are already overstretched. And one image which has been circulating, which is really striking fear into the hearts of New Yorkers, is refrigerated trucks parked at the back of hospitals. What are they there for? They're there because the hospital managers think that they don't have enough space in the morgues.
Dramatic scenes in New York. Journalist James Reinl, thank you for that.